Okay, we have GCTV on, which I think I was told that was going to happen. So the meeting is being recorded. I'm not sure if also by the city, but I think GCTV is working on their recording of the meeting. Thank you. If there's anyone else here who's recording the meeting, please let me know. Okay. And great, so we're all set with that. I would like to ask for a motion to approve the February 23rd and March 22nd minutes.
I'll make a motion to approve the minute.
Thank you.
Second.
Okay, thank you, Sam. All right. Are there any issues with the minutes as you read them? Any problems? Questions? Okay. All those in favor? Okay. Minutes passed. Thank you. All right, moving right along, COVID update, Jennifer and Megan, however you guys want to arrange that.
So as of today, we've had 75 cases in March. In 2020, we had 62 cases. 2021, we had 57, and now we're up to 75. And we haven't finished the month yet. So we're still higher than we have been in previous years. We have been getting tons of phone calls saying that people have tested positive on at-home tests. Like just before I left the office today, I got a call that 4 people were positive. So these numbers are grossly underestimated. We are having testing available at the health department Mondays, Wednesdays, and Fridays, 7 in the morning to 10 in the morning, or other times as long as they call me and make sure that I'm there. We did put an article in the newspaper with my cell phone number and things like that. So hopefully that'll help a bit. Jen, am I missing anything? We will be closed the week of school vacation, I'm thinking, because I'm going to be out in Texas. I might have somebody cover for me, but I'm not quite sure yet.
Okay.
Closed
and this,
for
of course,
testing, not the health department being closed.
right. Yeah, right. That doesn't happen. And the testing that you're doing is the antigen testing.
Yeah.
Or something. Yeah.
GCC also closed their tests. GCC is closing their testing site starting after tomorrow. And we found out this morning that CVS has closed their site for testing. So the options are waning. It's PCP's offices, Walgreens, and us that I know of.
Are you talking about for the PCR test? Is that what
testing in general.
Just testing in general. Okay, because I think it's important to know where you can get a PCR test as opposed to the antigen test.
Walgreens and primary care doctors' offices.
Okay. Okay. All right. Thank you for that. Okay. And anything
I just
else?
have a thing about the test stuff. I think we mentioned in the last meeting that with the closing of the GCC site, the state gave us, we were awarded a little over 5,000 tests. We were given 2,000 so far at home tests. I already distributed 1,000 to the COG, because it's for all of Franklin County, not just Greenfield. So I gave 1,000 to the COG with our first delivery, and I already had the nurses that cover Montague, Deerfield, and Sunderland have tests as well to use in those municipalities. On the tests themselves, there's going to be stickers that the FRCOG has made, which says, if you're positive, please reach out to, so people know what to do, and it'll be stuck right on the box.
Right. Okay. All righty. Yes, Sam.
How are the numbers in the schools? Are you having a lot of kids with it?
It's really hard to know. I hadn't heard of any cases, and then I talked to one family and they said, well, they got it from school. and I had no idea. So then when I started fishing around, I found out there was 11 kids that were out. This was not this week, the week before, but that I didn't account for. So it's too hard to even tell anymore. You know, I know that within the last 2 weeks, there's been 5 cases in one particular school. But it's a lot of it
You know,
is
we have the
hearsay.
stomach bug at our school really
So,
bad.
yeah, and that's one of the big concerns that I've been working on all day today.
Yeah.
That there is some sort of stomach bug going on. I called the epidemiologist. We started a case cluster. I've been recommending stool samples. I reached out to Franklin Medical Center today, asking if people come in, if they could do a stool sample to try to figure out if it's something as simple as the norovirus or if it's something else that we need to worry about. I know that there has been some outbreaks recently. When I worked with the epidemiologist, they said that there was a lettuce issue at the beginning of the month. We're not sure if that's still affecting people. So hopefully we'll find out what that is.
Okay, thanks.
Okay. Anything else? Any other questions or regarding COVID or related matters? Okay. Property inspections and follow-ups. So we don't have the benefit of Nicole's input. So Jennifer, you're on all by yourself.
Okay, so I have a whole lot to report, but I wanted to say, and I was hoping certain people would have been at this meeting, that there was one property we condemned last week, which was a controversial property, and the word on the street was that we did it because it was on the future fire department's land, this house. And that was quite insulting to us at the health department because our inspections are done, we treat everyone the same. And if something's not being done right by a tenant, we act accordingly. So I want to report on this case first. This is on Coombs Avenue. This case has been going on since about November. The landlord, since December, has not filled up their oil tank 5 times. We had to get the mortgage company involved multiple times to get it filled. The landlord was at first responsive, like in November, but since then has not returned any of our calls, any of our letters. There has been trash, which he's responsible for, that has been there, and now there's a rat issue on that property and bugs. And we have fined him over $5,000 in trash. We went to the apartment itself, and the housing situation, there's 3 families that live there, sometimes 4. Only 1 is on Section 8. The rest are just very low income and we're absolutely terrible. The upstairs bathroom, they have to shut their water off so the water doesn't drip to the downstairs bathroom. We requested that he fix it. He partially fixed it, and then about 4 weeks later, a gentleman on the first floor was using his bathroom. The person upstairs flushed, and he was covered in fecal material because of it being broken. That basically was when we said enough. I spoke to the city lawyer, and the tenants at this point were very upset, and we then proceeded with condemnation last week. He wasn't responsive to the condemnation order. We put all the tenants up in a hotel. Thank you, Salvation Army, for doing so. The oil company could not fill the tank because now the boiler is so bad that it's dangerous to fill. And basically now The tenant, because the lawyers, the legal aid lawyers, all lawyer can't reach this man. And one of the tenants picked up the court order for temporary restraining order. She drove it to Worcester, the Worcester area, delivered it to the sheriff's office, and he was handed the court order, and we're going to court on the 1st. No, that's not the 1st, on the 7th. And we're going to be proceeding with a restraining order and for him to permanently put them up in housing until those issues are fixed. And if he doesn't show up to court, legal aid is pursuing criminal action. So when I hear from people saying that we're siding with the fire department, the amount of work and energy that was put into this one property was unbelievable. And no one deserves to live the way those people are living. And it had nothing at all to do with just the trash. We don't condemn people over just trash. And we certainly don't go in cahoots with any other department. I just want that out there to the board. Any questions on Coombs Avenue? Yeah.
Once court is done, like what then happens to the building?
That I'm not sure. When we have the order to correct, depending on if it's a criminal versus he is forced by the court to fix it, he has to fix every order that is out there on that property. I don't know what he's going to decide to do. He's not responsive, so we can't even discuss with him, and he's a contractor, by the way, which is even more distressing in a way. So we don't know. It just depends on what way it goes in the court system. Any other questions for Coombs Ave? This Friday, I have court on a long-standing property on Allen Street. We're going to court the tenant as a tenant landlord issue. We condemned an upstairs apartment due to an egress. The second egress is not adequate. It hasn't been adequate. There was a lot of trash outside that wasn't getting disposed of, on the balcony that wasn't getting disposed of. The landlord corrected it, and every order to correct concern she corrected, but the property is still, the upstairs apartment is still condemned due to the egress is not safe. Meaning that the egress is in a very small area in a bedroom that goes through the ground, through the floor. The steps are very far apart and there's no handrails on either side. So buildings is involved with this as well. But again, like I said, that's going to court this Friday. Deerfield Street, 155 Deerfield Street has been a difficult property in the past. However, this issue was very complicated due to a tenant. And we wrote up a significant order to correct on this property. Significant. And the owner of the property called me and we went over each thing in order, and she put the resident up in a hotel for 4 nights while they corrected every single thing. And that is now in compliance. And that was also the week before and last week with Coombs Ave. I have an ongoing situation on a property in Davis Street. It's a noise complaint and odor complaint. And it's an owner of a house who has a wood shop, private wood shop. Well, it's not private, he does some very small business. There's a long history. It's been in court way before me in 2002. The DEP was involved, the EPA was involved. There was sound testing done. It went to court because of another tenant. And the owner of this property worked with the EPA on a specific smokestack that would disperse any type of vapors. There's a room where they spray paint the wood that is basically where it goes out through the vent. That was made with the DEP. The sound testing was done by the Massachusetts Department of Health. I went there today. They were actively working. I videoed the sound from the venting system, and it sounded like an air conditioner. I documented that. There was no smells. There was nothing that I observed today, because I got a new complaint today, regarding this property, but it's an ongoing investigation, still working on 202 Davis.
Okay.
And one more thing,
Yep.
the DPW has, we work with the DPW for trash that's along the tree lines or furniture. The DPW tries to help us as much as possible where people just leave a couch or a chair. But that's not always working. So the DPW gives us basically fines that should be given to people if their trash is not stickered properly, if they're not removing things properly. So basically, we have been giving fines to people that do not dispose of their trash appropriately. And there's a warning. There's a warning, and we say you have, 3 days, and then we give out another letter, and it's a small fine, like $25. It goes up to $50. It goes up to $400 a day if they don't remove it. So there have been some people that have taken their trash away right away, and there's some people that are, but that's an ongoing issue daily. And that is the property inspections that I've been working on. Any questions?
So it's obvious whose trash it is. It's the tree line in front of the particular home.
Yes.
Uh-huh.
I mean, if it's on the property itself, that becomes a different concern. If it's on the property itself, we actually work that up. I mean, depending if it's a hoarding issue or if it's just trash all over the place, and we work with the homeowner to see what's going on. That do they need help? Is there anything that's going on that we can assist them with to help them with their home? We usually reach out to social service agencies, especially if they're older and an elder at risk, to get them services. Because a lot of times what we see is if there's a lot of stuff on people's porch, let's say, a lot of times they're older, lost a partner, don't have children, and they actually just need, sorry about that, they just need help, and just saying, hey, are you okay? So that's what we do a lot of. So it's two different things. One's on the tree line, someone throws a couch out there and doesn't do anything with it. And then there's actual people that are in need, and we try to provide that help.
Yeah. So a myriad of issues with properties. It's your reports are always interesting and disconcerting. But thank you very much for the report, and also doing a really good job of keeping up on difficult circumstances that come before you.
I do have other good news. We've been talking to the COG about pre-rental inspections. And with that, we do MRVP inspections. I think we discussed this in the past with Section 8 housing. It's when the property is vacant before the landlord rents out this property. Before it rents out this property, we just check it out, make sure that they're in code. And the city is, when I spoke to the mayor, is supportive of that. So we do multiple, at least 10 housing inspections a week at this point, at least. And when we speak to the landlord, we mention to them, hey, we're thinking about doing pre-rental inspections. And first they're like taken aback, and we say, what it is it kind of gives you security that we know how the property looks now before you rent it. Because when we walk into a situation, we don't always know who's responsible for what. But if you have it inspected before you rent it out, there's already a baseline of how to move forward. And if I spoke to about 20 landlords, all of them were in support of that. So I thought that was very good news. Another thing we're looking into when it comes to property are short-term rentals. We're noticing that there are short-term rental properties that instead of renting out a property, it's like an Airbnb and people rent it for long-term. And there's issue with that for a couple of reasons. There's no hotel taxes, so the city doesn't make money on that. That it affects the housing stock in Greenfield, especially when housing is so tight. So we're thinking about, and it's very, I mean, this is very, very new thoughts, but I wanted to bring it to the board of looking at short-term rentals, and there's no inspections, there's nothing to check about this property, and wanted to see what the board would think about short-term rental inspections. I mean,
Well,
you don't have to answer that now, but you can marinate with that.
Yeah. Oh, yeah. I was going to say, how would that work? Would it be you mean a requirement? I mean, we would.
I'm not sure if we would make it a requirement or a recommendation, like if we're doing pre-rental inspections, like right now I'm just asking around. I'm pretty confident that short-term rentals might not be happy with that, having inspections. I don't know, but you know, I think that they are properties, if you're renting out to somebody, they should be looked into, especially if they're long-term renters.
But they're not long-term. You said they're short-term.
Well, I mean, short-term, but meaning they could rent at 3 months at a time. I mean, they're advertised when we were looking at them, perfect for a nurse, a
Yeah.
traveling nurse, and traveling nurses could be here a year. You know, so teachers, you know, adjunct teachers, this is perfect for a professor, perfect, you know, perfect for a student. These are things that could be 6 months, a year. So I think it's something to look into, especially because housing is tight in Greenfield. The health department has a vested interest in, you know, getting properties into receivership so we could get houses back into the housing market. I've been working very closely with the Attorney General's office. We have 10 properties right now in the works for receivership.
I have another question. So you said there's good news about pre-rental inspections, and this had to do with the FERCog. So the good news part is that.
I think that we're all on board. The good news is that we're not hearing, based on our little basic feelers that are out there, that there is not a lot of negative feedback back. I think that when we tell the landlords, this is, you know, going to benefit you, not just the tenant, I think that they realize this might be a good thing and not a bad thing.
And my recollection is that there was resistance to instituting that because of the fee associated with doing the pre-rental inspections.
In the past, I think City Council had that concern. I think that just having that idea and then writing a policy behind it and presenting it might be better this time, and just being more structured, seeing what other towns are doing, knowing the history of the housing market in Greenfield and the concerns that we have. We have data now that we can show that this might be beneficial to landlords. I think that the discussion of a fee, an MRVP inspection is $75. And that's a fee when the apartment is turned over. So if you turn over your apartment every month, then you're going to have a $75 fee every month. But if it's every year, 2 years, it's only going to be $75.
Okay.
So I think, though, that the city was not for mandatory inspections because of the privacy issues that are involved while people are living there in the house, and making mandatory yearly or every 3 years, depending what type of landlord you are. There's a lot of tagging and calling and pointing fingers at And I think that if I go into somebody's house and say, well, it's mandatory, I come and see your place, that takes the right to privacy away. I think that it's not impossible, but I think there would be a lot of hoops to jump over to do mandatory housing inspections, not pre-rentals.
So pre-rentals when they're turned over. So unit's been rented to someone for leased to someone for 5 years, becomes empty. That's the moment to go in and check it out. Spend the $75.
Yep.
Okay.
So yes, correct. And that's, I think, all I have on for properties.
Okay, great. Thank you. That's good. Okay, so Jen, you're going to give us an update on what's happened with the Jim's Tree Service
Yeah.
issue.
Yeah. So last week I met with a mediation company that is involved with the resident and Jim's Tree Service. And it was a person that will delegate who the mediator is going to be for this particular case. We went over the case in detail. We discussed it in detail. And I need to be present at the mediation, one, because I have to discuss the code that's involved. And I also have been more involved in this case with the person, the complainant, and with Mr. Elwell, the owner of Jim's Tree Service. And I've kind of been the intermediary trying to have them work together, but it's, a little challenging. I did recommend, as we discussed, to the mediator that I feel they should have the zoning department, someone from zoning there. Because of that zoning variance that's on there, it's very difficult. So that they're going to look into that. I think that it's more than just the health department here. I think it's a bigger picture and it has to be looked at as such.
So that looks like it's going to go forward after.
Yes, that will be moving forward. I haven't heard any feedback yet about the mediator or when the mediator is coming. I'm assuming he said it could be up to a month, the gentleman I spoke with. So I don't know when that's going to be, but I will give you an update.
Okay. So Alyssa, you indicated to me in an email you wondered if there was more info. Do you need more info than that? Or you're
No, that's all the info.
That's
Thanks.
what
I
you
didn't know
wanted.
if we were talking about it.
Yeah.
If something new had come up. That was all.
Okay.
Thank you.
Glad
Thank you.
that got taken care of. Good. Okay. I think a quick one, a nice resolution, the polystyrene cup use at Cumberland Farms and the variance that they asked for. And I sent you Alyssa and Sam, just briefly the letter that we received. So they've got the material now. They've got what they need for cups, and that's the end of that. So that was very satisfying.
And I actually know that that was the case because last week, a lot happened last week. Last week, there was an issue at Cumbies where the fire department was involved again because there was a car went on fire close enough to the gas tanks where the powder fell down, and I had to go to Cumbies and make sure that everything inside was okay. And it was. And as I walked around, I did not see any styrofoam cups or any polystyrene products. So I knew walking into it that they weren't using it, but we just needed to hear from the lawyers that were involved that that's the case.
Okay, great. So done with that. All right, Jennifer, Better Together. How's that going?
So we were just notified that they're going to be making the grant announcement on April 13th. It's a virtual meeting. We're going to be aware of our funding. They're going to announce it to the people who applied on April 6th. but we were already invited to the announcement of the grant awards on April 13th. So I think that's good news.
I think that's good news. I mean, if you're invited,
Usually.
I am hoping they're not
Usually it's a good
inviting
sign.
us and saying, you lost.
okay, well, I
Yeah.
love that.
Congrats.
That'll be
But there's
lovely.
a couple of other grants in the works. As you guys know, I'm doing an intermunicipal COVID contact tracing grant. I just, the group decided, we met an epidemiologist who's part-time, and I offered we all offered the position, but since it's going through the Greenfield HR department, we had to offer it to him. So that is, so we're going to be having our full complement for that nursing grant. I'm going to be applying, the RFP is coming out this week from the state. It's another intermunicipal grant, which will kind of help with making sure all the things that the health department's supposed to have, like making sure our full complement of inspectors and any other services we offer are in place. And I'm going to be going to the group that I'm already with, which is Montague, Deerfield, and Sunderland, because that's who we're joining forces with. I already spoke with them about it. They're bringing it to the boards of health. Deerfield's on board and Montague's on board. I'm waiting to hear back from Sunderland. This grant is about $300,000. Once we have a person that can help with inspections, we can use that money to getting software or good computers instead of the iPads, which don't really transfer images over as quickly as we want. It's very long and difficult. So we could probably do that with that grant money. So I'm going to be applying for that grant when it comes out. The other one, I did that already, is a grant. They were putting their feelers out. It's from the state as well. And it's a 3-tier grant where you can do 3 different options, but I was looking at policy change. And I said, yep, we are interested in applying for this grant. And the idea that I had and Megan and I talked about was having teachers and staff of Greenfield Public Schools becoming certified in CPR and first aid. And the reason why is there's not many. If the nurse is not available and there's no one that knows CPR first aid and 911 could take up to 5 minutes to get there, you need somebody there that can administer help. So I reached out to the superintendent of schools saying, hey, I put out feelers for this grant, and there's nothing in stone yet because they wanted to see ideas. And she was very excited about it. And she's getting me some data preemptively. So if the grant says, yep, you can do this, I will be working on that. And that's it. That's what's happened in a month about.
You've been busy as usual. Right.
I can tell you that I see Mr. Ayers is here. We are having, the state is coming in for the Lunt property in April. And I will have to be there. I think the mayor's has to be there. But they're going to be doing their inspection and of the property and if everything was remediated and so on and so forth. So the health department has to be present for that. So that's basically all I know.
Yeah.
For that.
Okay.
But since I saw Mr. Ayers here, I just wanted to say that we're aware of that.
Yeah. Yeah. And also, I think you said that the health department is audited. Also,
That's the audit.
oh, that is the audit. Oh, I
Yeah.
thought the
Well, I mean, I think, we have to be there and I have to have anything that they might need available.
Okay. All right. I didn't understand that before. So
Yeah.
that's
I didn't
what
know that.
you-
I thought the audit was something I thought of like in
Yeah.
healthcare, what an audit is, right? It's a little
Yeah.
bit different.
Okay.
I'm learning as I
But
go
that's
with this
what
one.
this is. It's an inspection or audit. Okay.
Yeah.
Okay.
It's an on-site, they're going to look at every single thing and every single paper and everyone has to be there. I'm assuming Mr. Ayers is going to be there.
All right. We have time for public comments, so I'm going to open it up for that. I'd like
Nancy, do
to.
you want me to moderate?
That'd be lovely. Thank you very much. I'll just sit back and we have time, so I would say it could be up to, say, 4 minutes per person.
Great, and I'll keep an eye on the chat too if
Great.
folks want to just register in there. Sometimes it's easier than keeping an eye on the whole screen.
Yeah. Okay.
But I do see that Glenn has his hand raised. So Glenn, go for it. We'll start with you.
Hi, thank you. Thank you very much for having public comments at the meeting. My name is Glenn Ayers. I live at 254 Davis Street. And Jennifer read my mind. I was going to ask you if anyone from the board or the health department intended to come to the site visit that DEP has scheduled for Wednesday, April, I think it's the 16th. Let's see.
I know, I keep thinking the 13th.
It's the
but I don't
13th.
think-
Yeah.
It is
it's
the 13th? Okay.
Yeah,
Okay.
Wednesday, the 13th at 10 a.m. And of course, I know that the board has already weighed in on their opinion that they're completely satisfied with everything that has taken place at Lunt. But you probably realize that the community is not satisfied. And I have heard a lot of comments made about the position that the Board of Health has taken. And I think that this is an opportunity for you to find out more and to ask questions if you do have any questions about how things have been handled there. But certainly being on site will give you an opportunity to have a better understanding of the extent of the groundwater contamination and the extent of the ongoing vapor intrusion into the buildings, and in general, the completely uncontrolled nature of the contamination at that site. There are no controls in place to keep the groundwater from leaking off-site into the adjacent neighborhood, which it has done. Numerous houses, I believe, are contaminated from that groundwater plume. And there has been no identification of the source of that groundwater contamination, specifically the dense non-aqueous phase liquids, the solvents that have gone down through the water table and pooled in a confining layer probably or on bedrock. And that pool of contamination will continue to create more TCE, which only partially dissolves in the water, perhaps for decades or maybe even for more than a century. And in the meantime, that groundwater plume, which is more than 6 million gallons of contaminated, TCE contaminated groundwater on that site, that's just the most highly concentrated area of contamination. That will continue to migrate off-site and continue to contribute to the vapor intrusion into the buildings on the property, which is exposing the workers, the staff, the residents in those buildings. And it will also continue to migrate off-site into the neighborhood and expose people without their consent. And it will continue to bleed into the storm drain system and be distributed throughout the city. No one knows where that contamination is going. That has not been studied. It's leaving the site. No one knows the fate of that contaminated. It could be contaminating other neighborhoods. It's about 1.5 miles between Lunt and the Green River. Anywhere along there, it could be contaminating any of the neighborhoods along the storm drain system. So all of that will be discussed at the meeting, and I hope that you'll be there. Jennifer said she will be there, but I would appreciate it if one of the Board of Health members were there to get a better understanding of
That's
the
time,
situation.
Glenn.
Well, perfect timing. Thank you very much for the
you.
opportunity to provide public comments.
Thanks. Pamela Goodwin.
Hi, thank you so much. I've been a little bit in touch with Jen from time to time as needed. I am a member of Greenpeace and have been for years, and so I'm thrilled to think that I can use my returnable mug at Cumbies. And I do happen to know that Starbucks is going to completely get rid. And there's a huge Starbucks crowd. That's not me. But getting rid of these cups, whether it's styrofoam, paper, straws, all that stuff, is not healthy for the environment. So I would just say it's wonderful to think that we can use our own mugs. It doesn't get my germs on anything because of the design of the coffee I'm pouring or the tea or whatever. So I wanted to make that comment. I'm also a member of Housing Greenfield and have been for many, many months. It's a huge organization of individuals, as you probably know, as well as agencies that are very, very interested in keeping people that are unhoused alive, not just in the winter months, but we work very closely with MJ Adams. We're excited about how committed MJ Adams is in finding places for people to be housed. So that's super important. And when you say 10 places may be going into receivership, that might be good news, but then we have to find people that are willing to fix it. So it's has to be very affordable. I'm sorry, would you like to ask a question?
No, just take your time. You have 4 minutes.
Okay, thank you. So anyway, that's super important to me. It has been. I was born in this city and I returned these last 3 years. It used to be a town when I was born here. I also am involved, unbeknownst to me, with the lump mess. And I don't really want another thing on my plate because I'm a volunteer in state public housing statewide. And so I was like, oh God, please don't let me do this when I think I'm just dealing with the homeless people and I'm doing all this other work, because I do live at the Weldon, if you saw my address, 54. So unfortunately, it's just I'm a 4-time cancer survivor, and we've had abutters release their HIPAA information. I'm a retired CNA and a retired teacher, and when they say I've been diagnosed with non-Hodgkin lymphoma, and they were willing to divulge their HIPAA, I have been fortunate with my types of cancer, but I am appalled at my friend, and I'm always appalled. I have to go to the DTA office for my SNAP, and I'm appalled at all of it. And I'm real unhappy, and a lot of us are real unhappy. So we're very hopeful that the DEP is going to come in and assess the situation. And that's all I want to say about that. My last comment is, and I don't know if somebody would like to, I'm happy to answer any questions or concerns, by the way, when my time is up. Living at the Weldon, we know that we have dripping pipes, leaking pipes, and mold. And I have a friend who had, I believe, a building inspector or somebody come over and took pictures and then disappeared. It was posted on Facebook, the mold that's here in this privately held HUD building. And I don't know where any of that has gone, except my friend cannot get a reasonable accommodation and get moved out of this horrific environment. She's on the first floor. The Facebook posting with all the mold on furniture, and Dawn passed, the daughter came in. It's all over the bathroom. It's all over his clothing. It was all over his furniture. And I don't know anything other than it went on Facebook for the whole world to see. And then I believe somebody is supposed to be checking it out. So
That's 4 minutes, Pam.
Thank you.
Pamela, sorry.
No, that's fine. I really appreciate your time.
Melissa, can I just respond to 2 things? It's important. I know I'm not supposed to, but this is a couple of things I think that are.
I defer to the chair. Usually we don't respond to public comment.
Can you communicate with Pam via email about that, about those issues? I kind of
Sure.
like to keep it fair.
Pam, could you put it in chat for me, please?
Sure, I'm happy to. And just so you know, we don't get to make any comment at the, forgot which meeting that is, but then at the zoning board, we had a lot of back and forth opportunity and we really appreciated that. So here's my email.
Okay.
And I know it's not your job to do anything about reasonable accommodation. It's our job as resident leaders to fight for that,
Mm-hmm.
by the way. Here we go. And can I have the name of the person that's gonna send me the email?
Jennifer Hoffman.
Okay, thank you, Jen. Oh, did I hit enter? No, I'm sorry. I have another Zoom shortly and I've had a heck of a day, so there you have it.
I appreciate that. Thank you. So that you two can communicate post meeting.
Thank you, Pam.
All right, good.
You're welcome.
All right, we're all wait, and maybe more public comments. Go ahead, Alyssa. Is there anyone else that you're seeing needs to step up?
I don't see anything else in the chat, and I don't see anyone else's hand raised. Anyone else? Going once, going twice?
Okay.
Okay.
All right. I would like to offer April 27th, Wednesday, April 27th, 5 p.m. for our next regular Board of Health meeting.
That works for me.
Motion to adjourn?
I can't.
You can't do that. Sorry. Okay. The week before?
I have my puppy's vet appointment that day.
Good.
I will find her and show you guys her before we go. Okay.
All right. Well, I would suggest the week before then, the 20th.
I'm fine.
Do we know?
Excuse me, April 20th? Yeah, go ahead.
Do we know if we'll still be meeting remotely or if we'll be back in person by then?
I think I have to say, for the sake of the environment and not driving cars around the county, this would be my preference, and I'll just put that out there. But I haven't heard any directives coming from anywhere on high, say the mayor's office, that we need to meet in person. So
okay, the 20th works. Then I just might.
You just want
be
to,
in
yeah.
Physically.
Actually,
yeah. Go
the
ahead.
governor's office
Yeah.
about meeting in person versus virtual. They would like people to go in person, but if there is a written reason why, then, and if the city allows it, then you can have virtual, like a hybrid meeting. They would allow hybrid, but it has to be written, and the city has to approve it.
Well, maybe we can take that up.
Yeah.
At the next
Absolutely.
meeting.
We can put it on the agenda for next meeting. I'll leave myself a note. Okay, so we're looking at now does the 20th work for you, Alyssa, and Sam? And Jen?
Yeah.
Okay. All right, so April 20th at 5 p.m.
Great. I'll make a motion to adjourn the meeting.
Thank you.
Second.
All in favor? Okay.
Thank you very much.
Thank you. Thank you.
Take care.
Have a good evening.
Thank you. You as well.